All right, ladies. So I'm very excited to introduce our next guest, who is a former client, a brilliant doctor, an amazing life coach. And we're going to talk today and give you some tips about how to balance out your very busy life. She's an expert in this, amongst many other things, but she is an expert in this, and her name is Dr. Nothando Wohlgeschaffen. Did I do that right? We did a whole practice before I pressed record, and I'm like looking at my phonetic. I'm going to let you say it because we want to respect the last name. So go ahead, pronounce it correctly for me.
Dr. Nothando Wohlgeschaffen. Thank you.
Wohlgeschaffen. That's right. Okay. So my phonetic spelling did not work, but thank you so much for being here. I'm so excited to talk to you and just get into how you help people. And I know that you're a doctor, but we're going to be talking from the life coaching standpoint today, and even how that melds together, right? Your profession as a medical doctor, your profession as a life coach, and how that works together. So tell me, how did you even get here? How did you get into life coaching?
Yeah, well, I'm so excited to be back chatting with you. And like you said, we did a lot of work, even talking about names and professions and pronouncing things. I think one of our first sessions was all about my names and what it meant to introduce myself as a doctor and all of that good stuff.
Absolutely.
But your question was, how did I get into life coaching on top of everything else that I already do, right?
Yes.
Okay. Excellent question. So I will say in medical school, and I probably could have used you in medical school back then. In medical school, I used to get sort of in my feelings with the fact that whenever we had evals, Johnny would get, well, your differential diagnosis was excellent. And Sam would get, well, that was a really great demonstration of whatever particular physical exam skill. And then they'd come to me and they'd be like, Nothando, the patient really felt heard. And you had really great soft skills, which actually is, such an amazing compliment and a really important part of the art of medicine. But at that time, I really felt like, okay, well, what does that mean about me as a doctor and my, knowledge of pathophysiology? But I took that with me and I continued to work on, my one-on-one skills, my communication skills, my therapeutic skills. And after completing my family medicine residency, I completed a few more fellowships, including one in cognitive behavioral therapy, which involved a lot of one-on-one work, providing therapy for people. And I started to notice that some of the folks that I was seeing were really quite ill and met a specific DSM-5 criteria, meaning perhaps they met the criteria for a diagnosis of depression, or perhaps it was for anxiety. And then others of those folks didn't actually meet a DSM-5 criteria for a particular mental health diagnosis. And so that was really interesting to me that my soft skills were helpful in a therapeutic sense. But then I started to think, I'm pretty sure that other folks might need one-on-one support outside of a traditional therapeutic relationship. And long story short, this was also in the middle of, or right in the beginning of the pandemic. And a lot of my colleagues were quite stressed out, quite burnt out, feeling a lot of the pressure of providing healthcare to people in a pandemic. And so I decided to use my skills in a coaching lens that way, and started coaching other clinicians and other people who show up for people on a professional level. So that's kind of the long version of how I got into coaching. A lot of different nudges. And then, of course, working with you really launched my trajectory into coaching. That really, I would say, was the ceiling point where I actually decided that this was going to be an important part of my work.
I love that. I think it's so interesting because you have such a great story, and it's so impressive, right? You're a medical doctor. How was that? Because I think a lot of women struggle with, how do I do these two things, right? I'm a doctor. How did you reconcile, okay, I'm also a coach. I'm a doctor, but I'm also a coach. How was that? How did you get yourself to the point where you could start telling people, I'm a doctor, but I'm also a coach and I can help you in this capacity? What'd you have to go through to get through that?
You remember. It was a lot. I went through a lot in order to do that. And I think that part of that is, especially for, high achieving women, like the women who listen to this podcast, we are so conditioned to lead with our titles and our education and our experience, and all of those things are lovely things, right? They're huge privileges, but when that begins to shape your entire identity, I think it can become problematic, and it can start to hold you back if you don't manage your brain around how this is useful. Right. And people are probably like, what do you mean being a doctor is going to hold you back? That's not what I'm saying. It was when I was telling myself, well, I'm a doctor and therefore I can't possibly, also be a coach. And for reference for your listeners, I'm Canadian. I practice in Canada, and over here, our healthcare services are free. It's a very different concept for us to have to think about paying or, paying for insurance or all of the very different models of care that you all have. So for me, I was very fixed on the idea that it would be quote unquote unprofessional for me to have a private practice and charge people money for my coaching. And the first few sessions that you and I had, I really had to work through this idea of it being, in my mind, unprofessional to have a private practice and also provide a public service as a physician. Right. So I had to work with you to sort of expand how I thought about myself, not only professionally, but then also like personally and spiritually, because at that point, my leading identifiers were, I'm a Black woman physician, and that had nothing to do with the divine gifts and the bigger picture. Right. And so certainly that has shifted, and working with you was so instrumental in that, because now I don't define myself by my profession, although I'm so fortunate that I am a physician, and I'm so fortunate that I get to work with clients in a coaching container. Those actually aren't my leading identifiers.
Yeah. And what I love about you, and I always would joke with you, and will continue to do this, is like, you remind me of me like 10, 15 years ago. Because I had the same struggle, right? And it was so interesting watching you work your way through that, because I think a lot of women don't do that work, right? It's like, no, this is what I do. I'm this title and that's it. And you fought through that for a minute.
Oh my goodness. It was a long time. Yeah. But I also had you as an example, as a coach, and also as an example, because you worked through a lot of my faulty thinking around it. And then I literally would get on a call with someone who looked just like me, right? And who had already done it. So yeah, that was really interesting. Even right now, no one can see you except for me, but you're like in my ideal outfit. Remember, I had that exact same pink top with the poofy sleeves. You look great. But yeah, we're so similar in so many ways. Yeah. And that was really helpful to see you as an example of someone who'd done that.
Right. And that's what I love about coaching, because I needed somebody to help me see it. Right. Like I needed that as well. And it's so powerful to go through this work, especially because you have such a gift, right? That was pointed out to you in different parts of your life, right? That you have this gift and that you needed to share it with other people. And so the fact that you were willing to do the work says a lot about you. And it also makes you a more powerful coach for your clients. So when clients come to you, what is their main struggle? What's the main issue for them?
Yeah, it's a really good point because I can see my main struggles in them, right? The ones that I
Mm-hmm.
had to work through keep coming up in them. And so I can definitely empathize. Whereas in medicine, right, someone may be going through or living with a diagnosis that I obviously don't have personal experience with. And coaching, if they're going through it, I've been through it. So a lot of my clients come to me feeling unsure about whether or not they want to keep continuing in their field. Um, and I think that that's a perfectly legitimate and okay place to be. What
Mm-hmm.
becomes difficult is when they're asking that question from a place of burnout, right? It's one
Mm-hmm.
thing to say, I don't think I want to do this anymore. I know that I'm called for something else, or I know that I have this big dream and I'm no longer interested in the space that I'm at. But it's another thing to say, well, the pandemic has been really hard and my institution isn't thinking about me as an individual, and therefore I'm going to leave. So I think when people come to me, it's really about how can I create more time for myself and for my life and be as healthy as I'm asking other people to be. And it's a lot easier than we tend to make it out to be. We can do both. Like you can work in a traditional job and you can start a business, or you can start a business and start a family, right? Like it's not
Mm-hmm.
necessarily an either or thing, which I think is a message that we get a lot of. Pick one thing and one
Yeah.
thing alone forever and ever. Um, there are ways to navigate, all of your interests and all of your passions. And so I think that's what people come to me with is I'm pretty sure I like my job, but now I'm feeling really tired and I don't know if I should just leave. Can you help me type thing?
I think that's such great messaging too, because a lot of what you see in the coaching industry on social media is this leave your job, be a girl
Mhm.
boss, do this. And
Yeah.
it's this push to like entrepreneurship when that's not necessarily everybody's 10 out of 10, right? That's not their dream of
Yeah.
having it all. It's not, maybe being full time in a business. It might be like, okay, I do this and I do that. And you're one
Hmm.
of the few people, one of the few coaches that I see really saying it's okay, right, for you to love
Yeah.
what you're doing and also do this other thing that you love doing and finding that balance.
I know. It's really interesting because there are a lot of groups that I've considered being a part of, and like one of the requirements is that you are a full-time coach, which I think is
Right.
such a lovely position to be in, right? I think it's really cool when you and other folks have created that for yourselves, but I like love my patients and the clinics that I work
Mm-hmm.
at, and that has never been my intention. Although, I mean, things shift and, we all have different seasons in life, but you're right. There is an option to actually really love your
Right.
job and also want something on top of that. And that's something that you and I coached on a lot was this idea of it being okay and me having permission to really love my job and want more. I think that was one of the biggest
Mm-hmm.
revelations, I guess you could say, that you had helped me with, because at one point I was like, well, I was struggling with a lot of guilt. I really
Mm-hmm.
already love my job. So why is it that I think I need to also do this other thing? Shouldn't I just be happy where I'm at?
Yeah.
I can't possibly want more. And I'm sure you hear that a lot. But for me, that really was convincing thinking like, no, I can't possibly also build a coaching practice when I already have everything I could possibly want. Right.
Mm-hmm. Absolutely. What do you find to be like the recurring thoughts that your clients have and the women
Hmm.
and the men that come to you? What are the
Yeah.
recurring thoughts that kind of keep them stuck?
So, first of all, like, I'm a doctor, I'm a lawyer.
Uh-huh.
That one there, like, I can't do this because of this. What will my patients think, or what will my
Mm-hmm.
clients think? A lot of really constricting thoughts, I guess, around what it means for them to be a professional in their space. That's a huge one. And then we've got a lot of should thinking. Of
Yeah.
course, I should do this, or I should be able to do that. And I think that really gets in the way. of people all the time. I always tell people, should is a cognitive distortion. It's an unhelpful pattern of thinking. If it's something you're telling yourself you should do and you're not able to follow through with, right? That just creates guilt, which is different than if you say, I should work out and then you actually go work out. That's fine. So the professionalism thought, the should thought, and then another common thought that I see in a lot of my clients is, I'm not sure. Like, I'm not sure if I can. I'm not sure how I can. And I guess it really leans into some of the perfectionistic tendencies that we have, that if you're not sure exactly how things are going to map out, that you can't take a step forward.
Right.
Which makes a lot of sense, right? Like, we like to have everything laid out in the 5-year plan and the 10-year plan and know exactly how things are going to go. But that's just a very convenient thought that will keep us stuck, because we almost never know how things are actually going to turn out. And that was certainly the case for me in the beginning of my practice. So, yeah.
Yeah. And because you work with such high achievers, right? Very, high level professionals. Another thought that I find to be common is this, it's the perfectionist, but it's kind of this perfectionism, but there's an underlying fear because high achievers are not used to being bad at things and not being really good at things. So when you first start out, you may not be like at the top. Do you find that a lot of your clients, because they're, high achieving women and men, they're not willing to quote unquote be bad at something to start it out? So that kind of keeps them stuck.
Yeah, I do. And it also comes veiled in like a lot of questions, right? Like just doing research about it, or, tell me all the steps, right? Because we don't want to not appear to be competent, right? Like, we really want to know our stuff before we get started. So I think you're absolutely right. That happens a lot too.
Absolutely. And, during one of our sessions, I was so, it was fascinating to me because of the way you have a different approach as a coach. And with one of your clients, you did like a cooking class, right? Tell me how that, tell me about this approach and how that was helpful. Cause we didn't do that.
Yeah, we didn't do that. And I'm glad, because you know what? I actually don't even really enjoy cooking. So I really felt like I went above and beyond for this particular client.
You really did.
And the thing is, that came about because my clients, like yours, are high achievers. And so we like to think about things, right?
Yeah.
We spend a lot of our time in planning and researching and all of that great stuff. And then we spend less time in the implementation of those thoughts. And so this was a client who wanted some help with his physical self-care and creating a more consistent routine in terms of moving his body, really. And throughout our sessions, it just became more and more apparent that, like, he never cooked, and not because he didn't want to, but just because he didn't really know how, and was constantly just buying what was available at the hospital, which is not usually the best food anyways. And so instead of talking about meal prepping and planning and all of that stuff, we just cooked. I sent him everything he needed, like a good food box, except it was a Nothando Wohlgeschaffen box, and we cooked on a session, and it was just a much more useful use of his time at that time. So that's how that came about. I don't do that regularly. Don't come to me for cooking coaching, although if you need it, we might be able to figure it out.
Yeah, just to be clear, you're not doing that again. But I think it says a lot about you as a coach, that you noticed something in your client and you knew that this was the best way to go about getting that breakthrough for him. So tell me, what is the most exciting, memorable success story or breakthrough that a client of yours has experienced?
I wanted to tell you about this because we haven't gotten a chance to talk lately. And so I haven't updated you on all the fun and exciting things. But I think a really big area for improvement in any high achieving person is the skill of self-compassion, for sure. And we hear about this all the time, and no one wants to talk about it because, we know, or so we think. Again, we know intellectually, but not in terms of actually implementing this. And so one of my clients who came to me specifically for help in the dating world, which I think is so fun, finally decided to start coaching with me. And right when we started, it's kind of it's a difficult scenario. So it's not a happy story in the beginning, but it becomes happy, I promise.
Okay.
But her sister was diagnosed with breast cancer, and her mother had a hemorrhagic stroke right when we started coaching.
Oh, wow.
And she was so focused, right, on reaching her relationship goals, which is completely understandable. That's what we were going to focus on. But week after week, she would be so exhausted and so stressed out and so upset that she hadn't been swiping left or right. Right, on dating apps. And, we spent a lot of time talking about how none of that is relevant right now in this moment. And it doesn't mean you can't have it later. It doesn't mean it's not going to happen. But there's no point in adding stress on top of what you're already going through, right? There's no point in being harsh with yourself about not being able to achieve this thing while you're supporting your family. Right. And so she had to leave the province to be with her family and to advocate for them. And luckily, both of them are doing really well, both her mom and her sister. And the breakthrough moment for me was when she messaged me before she got on her plane back home and said, you know what, I'm going home. I feel fine about this decision. Everyone seems fine without me. And now I need your help responding to all these people in my inbox. And we were just talking about dating at that point. And it was so interesting because the breakthrough for her was in recognizing that, my goals are important and they're achievable. But it's also important that when things happen, I can be kind to myself and lay those down for a little bit, that I can have compassion for myself and really cut myself some slack when it's needed. So when we talk about self-compassion, again, we get it, except then things happen. We have a really busy work week, or, we need to show up for our families, and then we forget all that stuff.
Yeah.
And so I think for her, really walking through that and seeing that her goals were still there on the other end of things was really, really lovely and such a relief, because it was a really stressful time for her too.
That's huge. Yeah. So, and you talk a lot about self-care and compassion, and you're right. We all know it, but doing it is a completely different thing. So that is huge. And speaking of self-care, right? What's one tip? What's one thing that you can give to our audience, our ladies who are all over the world, including Canada? Hey, Canada. What is one piece of advice that you would give to somebody to take care of themselves, to have a better day?
Yeah. I would say, particularly for those of us whose job it is to show up for other people, is to practice using the same level of care that you do with your patients and clients with yourself. I think it's really interesting the way that we talk to and show up for those folks, right, on a professional level. And I would just say, if you could use even a fraction of that skill that we know is there because you show up for other people for yourself, then that's going to make every day that much easier for you. Because if you can treat yourself like you would treat other people, I think we would be so much more in tune with what we need in the moment. We would be so much more in tune with how we need to be addressed and what would be good for us in the long term if we just gave ourselves that same level of care and compassion.
Yes, I love that. I love that. So you are on social media. You're a writer. We didn't even talk about
Yeah,
that. You're a
I
writer. You
know.
have blogs. Tell everybody, tell all of the women where they can find you, how they can follow you, and how they can work with you, not cooking, but through coaching.
Yeah. These days I am on Instagram most often. Nothando Wohlgeschaffen. There's only one of me. So Nothandowoh. If you type that in, the rest will be there. You can also find me on my website, nothandoswan.com. Nothandoswan.com. Send me a DM or click on the coaching services tab on my website, and that is how we can connect.
That's amazing. And can they subscribe to your email list through your website too? Or
Yes,
how do we
absolutely.
read your, okay.
They go to my website and pick one of the free resources. There's one on imposter syndrome. There's
Ooh.
one on a weekly calendar. People love to schedule. If you're very organized like I am, just grab one of those free resources and we'll stay in touch that way too.
I love that. And we'll have all of that in the show notes. So don't feel like you got to scramble trying to spell Notando's last name. She's the
Thank
only one.
you.
She's one of a kind, original. And I just want to thank you for taking the time out because we've gone back and forth with a couple of dates. So thank you so much for agreeing to this. I know this has been helpful to our community of dangerous women because we're all out here doing the most and we need to take
Yes.
that break and take care of ourselves. So thank you so much for being here. I really appreciate you.
Thank you so much for all of your work and for coaching me.
Of course. If you found today's episode helpful, go ahead and hit that subscribe button and subscribe to this channel so you never miss an episode. And I'd really love to hear how you're doing. You can find me at Dr. Crystal Connor on Instagram, Facebook, and LinkedIn. I can't wait to hear what progress you've made. So until next week, see ya.